at work, and we would run into each other at the proverbial water cooler, or perhaps talking across cubicles or wherever it might be in the office. We would have these informal conversations among colleagues that can really move the needle in some exciting ways. And trying to outsmart the PowerPoint dynamic, we can kind of really quickly zoom out on. Instead, set up this idea of a cafecito meaning small coffee. My name is Dr. Eliana Ramirez. I am the director for the Community Mental Health Equity Project Training and Technical Assistance Center. I'm here with my colleagues from SSG, Special Service for Groups Incorporated, one of several partner organizations with the CMEP TA Center. We are here today to do a cafecito, which is a short informal conversation among colleagues that's recorded for the purpose of sharing information to the field through our social media and our website. So I'm going to start off by saying welcome to SSG. It's so nice to have you all here. In the beginning of the pandemic, when so many of us went into socially distanced workspaces, we really missed the opportunity of connecting with colleagues, talking to one another over our cubicles or in the proverbial water cooler area of a break room. And so often, those informal conversations among colleagues are really critical to innovative practices, right? To moving the needle forward in justice, diversity, equity, and inclusion work. So that's why we came up with the cafecito. So if you happen to have a little coffee with you, which is what cafecito means, you're welcome to drink it, or water, or whatever might be around you. And we welcome you all to our space together just to chat with each other. So welcome to you, SSG, and we'd love to hear a little bit about who you are and SSG. So I will send it over to Erica, I believe.
Thanks so much for having us here, Eliana. It's really great to be able to gather, and just to tell you a little bit about maybe our team first is just, my name is Erica Jun. I'm the co-director of the research and evaluation team at Special Service for Groups. And maybe I'll just allow the rest of our team to introduce themselves first and then pass it on. So I'll pass it over to Jesse.
Thanks, Erica, and thanks, Eliana, for having us. It's such a pleasure to be here. I'm Jesse Damon. I am co-director of the research and evaluation team at SSG, and I'll pass to Lindsay.
Hi, everyone. I'm Lindsay Yorana Chen, MSW, and I'm a senior research analyst at SSG. It's a pleasure to be here, and I'll pass it to Trey.
Hello. Thank you, Eliana. And this is very exciting for us to share our work with you. My name is Dr. Trang Huang. I'm with SSG in the capacity of being a consultant for this particular project. And it's been really a wonderful experience so far. So glad to join you all.
Thank you so much. It's really always a delight for me to be in a Zoom room with the four of you. For anyone who's not familiar with CMEP, the Community Mental Health Equity Project is funded through AB 74. We are tasked to do two main things. The first is to provide training and technical assistance to the state of California in service of culturally and linguistically appropriate service provision at the county level. We also support counties and community-based organizations in addressing health disparities and health equity from a data-driven and evidence-based as well as community-defined practice space. So for anyone who's out in the community who says, oh gosh, I'd really love to submit a TA request for no cost training and technical assistance, we are here for you. You might have a question about how to apply class standards, culturally and linguistically appropriate standards to your work locally, or maybe you're curious about how to use data to drive health equity work locally. We are here for you. And so as we're going to get into this discussion here, it's just really exciting to hear from SSG, one of our many partners on this organization, who are going to share a little bit with us about the expertise that they bring to our project. So without further ado, we'll start off with our first question, which is, tell us a little bit about your organization and the work that you do.
Thanks, Eliana. So our organization actually is a large health and human services organization that provides services throughout the state of California, in Los Angeles, San Francisco, Riverside, and Orange counties. And we have about over 20 divisions that provide lots of services across very diverse communities. We have deep roots in the API communities, Asian and Pacific Islander communities, but we work broadly and have experience working in diverse communities, anywhere from working with youth to people with disabilities, people experiencing homelessness, justice-involved individuals, and also LGBTQ plus communities, among others. And so we have a broad range of experiences, and a lot of how we came into this project actually is because we have, for the past 5 years, had the great privilege of working on the California Reducing Disparities Project. And so we've been able to work with Asian and Pacific Islander communities and the organizations that serve them in 7 different areas with 7 different organizations or collaborations throughout the state of California. We are the technical assistance provider on that project. And so we have a lot of rich experiences being able to provide very tailored TA or technical assistance to those organizations. And so we're really looking forward to bringing that expertise and that knowledge to this project as well, and working with the different stakeholder groups.
I'd like to add a little bit too about our experience through CRDP, the California Reducing Disparities Project. As Erica mentioned, we're working with 7 different orgs, but those orgs actually are serving incredibly diverse Asian and Pacific Islander communities, speaking over a dozen languages, with really rich and different immigration and mental health experiences. And I've had the privilege of working with Hmong Cultural Center of Butte County over the past 5 years, which is in a rural part of the state, a small org that is really the one-stop shop for the Hmong community in the area. And in our time together, we've gotten to understand their needs as they've grown from a very small, less than 10 staff organization to a significantly larger organization. And to work with them around area issues such as community engagement.
Yeah, and I'll share a bit too. So I'll be one of the primary coordinators of this project, so you can look for me in future collaborations. My experience is in integrative health and mental health and working with Asian Pacific Islander communities, behavioral health, counseling, chemical dependency, working with youth and adults, LGBTQ community, as well as experience with working with grassroots organizations, local government, and philanthropy to advocate for the well-being of cultural and diverse communities. And we've learned a lot about what communities need, specifically language access, culturally specific staff, and programming, and a connection to a community-based organization. And I'll let Trang continue.
Yeah, we'd like to share a little bit of sort of our experience working with community-based organizations. We ourselves are a CBO, if you will, but we're a big CBO, and we have Medi-Cal certified funding with the county and the Department of Mental Health. So, and we have funding sources, diverse funding sources with SAPC and Department of Health Service and Office of Diversion. So what we'd like to do is to share a little bit of our work experience with, any groups requesting TA. So we want to tell you a little bit about some of our experience with communities within LA County, but also our collaboration with county agencies, with other CBOs, with non-county, but sort of faith-based communities as well. So, the origin of SSG, traditionally, we started with a lot of focus on technical assistance for capacity building for new and upcoming small organizations. And we ourselves have grown so that now we're providing a wide range of diverse direct service across age group, like Erica mentioned, from children to older adults. We also have programs with a wide range of levels of needs, individuals coming out of institutional setting, individuals needing housing, justice involved, and then also medical and substance and behavioral health needs. The other thing that we sort of struck us recently, we were being certified by CARF. So the CARF reviewers were really blown by the number of languages that our staff speak. So that speaks to, they were like 21 languages. It's only day 2 and I've already counted 21 languages. So that speaks to the diversity of our staff. And so our experience has been focusing on capacity building. That's one of our big focus for, especially for this project, is to support folks at all level, from the county to reach out to CBOs, and also for CBOs to increase access to county and other agency settings. So we are looking forward to sharing more details with you. And so that hopefully gives you a quick summary about what we do, and we'll pass it back to you, Eliana.
First of all, congratulations getting through CARF accreditation. Oh my goodness, that is no small feat. I've gone through CARF accreditation myself when I worked at Veterans Affairs, and it is what a huge undertaking, and what an incredible feeling that must have been on day 2 to receive those kinds of kudos. 21 languages, that really is incredible. Clearly, SSG is doing something really right, not only in identifying the importance of having multilingual staff, but the fact that you're able to attract and retain staff with such a key critical skill set. So congratulations to you on that. I'm really especially interested also in what you were talking about regarding capacity building and that relationship building between county behavioral health departments and local CBOs. Part of what we are tasked to do as a CMEP TA center is to really strengthen those relationships wherever we can. We know that it is most effective addressing health disparities when there's a really solid relationship between CBOs and the county behavioral health department. And as much as that sounds lovely on paper, it's a whole nother thing to make it happen, because it's oftentimes different cultures, right? And different organizations coming together, working for the same goal. We are so lucky to have you on this project for so many reasons. And I wonder if you might share a little bit about what you're most excited about or looking forward to in working on the CMEP project with the rest of our partners.
Sure. First, I'm very excited to work on this project. I grew up in Southern California in a Fujian Myanmar family, and we have a beautiful culture, our own forms of community support when it comes to mental health, but we are generally unrepresented by dominant systems. So I think it's really a privilege to be able to participate in this project. Working on CMEP, working with you all at CARS, it's been a breath of fresh air. I really enjoyed reviewing the cultural competency plans of California's counties' behavioral health care systems and their commitment and strategies towards cultural linguistic inclusion and representation. I'm looking forward to hearing more about the feedback of our cultural communities to see how the plans can be improved and practically and in real time. And I'm also very excited about the diversity of strategies of mental well-being that is based in cultural wisdom and expertise that will inevitably arise through this process and through the increase in cultural staff representation within our behavioral health care systems and partnerships with cultural communities.
So exciting, so many things. We've been involved, Lindsay and I have been participating in various events that we've had so far. And similar to what Lindsay was saying, I really love the potluck hour that was sort of forced us to come back to our own roots. So that was a kind of a nice beginning, Eliana, to sort of think about my own culture from Vietnam, and what can I contribute to this process of equity, right? And reducing disparity. So that's already been personal learning. And then participating and seeing the collaboration among the partners and CARS, it's been really a big learning experience to watch our lovely music. We start out with our music, or just with the way that we run our meetings and the way that we ensure everybody's equal voice. That's been very inspiring. Then the listening sessions were amazing. They're so rich with different needs from different stakeholders. So the conversation from ESM, they were able to share their own frustration and their own difficulty despite their commitment. And then in the CBO listening session, I hear the same thing. I hear commitment and willingness for reducing disparity and wanting to have equity, but also different sets of frustration and constraints and challenges. And so it's what I look forward to in this project is for us to come back to sit down with the data, as you talked about before, and to really look at multiple stakeholders, all these three different groups, and think about ways to find commonalities, ways to reduce the similar challenges, and or remove some of the barriers, the specific barriers for each of the groups. But really what's been inspiring is every stakeholder group, their commitment to equity. And so it really does highlight the name of our project, right? So it really brings it home for me. So very excited for the next path, for our next journey.
I'm going to keep jumping in, but I don't want to cut anyone off. So just let me know if I can stop. I really appreciate, Trang, what you were just talking about of the commitment. I am bowled over. I am so humbled talking to the ethnic services managers, the ESMs at the county level, who oftentimes are the people who write the cultural competence plans, as well as the community-based organizations who are engaged in this work as well. And of course, then the county behavioral health directors. All of these three groups, as you mentioned, are not only engaging in really critical and frankly difficult work, right? Addressing health disparities, but they're doing so in the middle of 2022, which is not an easy time for any of us. My goodness, the fact that we are behavioral health providers addressing these issues in the middle of a global pandemic, when we've had firestorms and megastorms and everything else that's going on, it just highlights for me that commitment that you mentioned and an incredible resilience in our communities to continue doing this work. I think many of us are drawn to this work because we have personal experience in some way or another around diversity, equity, inclusion, or a desire or need for greater health equity. And it means so much to be able to partner with people who are involved in CRDP, the California Reducing Disparities Project, because you all have found some really incredible strategies to make significant and systemic change. And so I'm really excited to join with you all and to be learning from you all as we continue to build on that work that you've been doing. I think what you were mentioning before about our trauma-informed approach, we value the idea of trauma-informed practice, not just on a clinical level, but in terms of business practices. And how do we attend to the real challenges that so many of us are, well, all of us are living through right now, while also coming from a strengths-based perspective. I know several of us here right now are social workers, so you can't get the strength base out of the social worker, right? And so we really strive to do that as well, that we address health disparities, but we always hold the incredible, real strength and resilience that our communities have, because my goodness, we're still here. And that we get to be with one another in this work is really, it's really an honor. And so talking a little bit about the kind of work that we're going to do with the community and focusing on the types of TA, the technical assistance requests that anyone in the state of California can ask of us at no cost, again. What types of technical assistance request is SSG most looking forward to receiving? Or what kinds of technical assistance are you best positioned to support?
Thanks, Eliana. we often like to think of ourselves as generalists, although we come at our work often from the perspective of evaluation. And so to understand an impact a program is having, what information do you need to know to improve well-being and quality of life in the community you're serving? How do you use that information to advocate for additional resources? So we often use evaluation as a window to understand community needs, program impact, organizational functioning. And so our TA, we're looking forward to TA requests that get at anything around program design, evaluation, organizational development, outreach and engagement, advocacy. But I want to talk a little bit about our approach, which I think is what might make us a little different. We really strive to bring our values to our work, and we think of them in terms of community benefit, cultural responsiveness, social justice, and transparency. And I've been enjoying this conversation today, particularly the discussion around resilience and relationships. And I've learned in our experience about the critical role that relationships and trust play in TA. And we like to think of the folks we work with as true partners. We see true partnership with TA recipients because we recognize that they have the expertise, the experience, the insight to do their work and to thrive. And we look for ways to complement that and to help them identify the challenges that they're facing and work together to address those. We do that through listening and through relationship building, through understanding their goals and their challenges, and then trying to identify and explore what might be a viable solution to help you move forward in the work that you do. Part of what we've learned too is that disparities persist so often because programs and services are delivered to communities instead of with communities. And so we're looking for ways to bring humility and expertise into these relationships so that we can design services that are owned and have input from the communities that they're serving. We also really try to bring an action-oriented approach to this. And so if we're, the work that we're doing, the data that we're gathering, how are we applying that? How do we take that forward? How do we push policy and systems change?
And I think also, if I could add to that, is just that, you know, we've worked with so many different types of community-based organizations and agencies that we have a broad range of experiences to pull from. I think we've often been asked, you know, for templates or kind of a single approach. And we often push back on that because we really realize that people and organizations and agencies are so different that we really want to meet them where they're at. And that means not assuming that there is one cookie cutter approach to things, but that we actually want to be responsive to the agency or the organization that is seeking the technical assistance from us. So we really work with listening and trying to build a partnership with those who are seeking the technical assistance, trying to really build that relationship and understand where they're coming from. And I think even though we mentioned, Jesse mentioned coming at it from an evaluation perspective, really destigmatizing evaluation in that sense and not looking at evaluation as an assessment of the people that we're working with, but actually working in partnership to figure out the right answers or figure out the answers to the questions that we're asking together. And so we provide really highly tailored, highly responsive TA. We like to have a scaffolded approach where we go through a process and we build that process together. And then we also try to set realistic expectations so that we're not, we're working with a consistent timeline together and being able to reach actionable goals. So part of this comes through, I think our whole team is really very diverse in its experiences and knowledge. And so it's bringing in all these different perspectives to have a very non-judgmental approach to the work that we do. And so I'll pass it over to Trang to add her expertise.
Always that little unmute button. Yeah, so we want you to know, Eliana, that, you know, we're only representative, four of us. Just we are representative to some degree of the SSG expertise. But within SSG, there are different groups. Like we have a division that's Asian Pacific AIDS intervention team, specifically work with LGBTQ community, but also with who are AAPI. We also have groups that work with justice involved individuals, also individuals who are have limited English, who also need, you know, placement for co-occurring needs. So there's a variety of expertise that hopefully in future Cafecito, we may introduce you to some of these other folks that we have connection with. So we look forward to bringing them on board as well to be available. But for this project, we want to offer what we know so that if it is something that the folks from Santa Clara or Butte County or any other counties in California say, hey, I do want to look at collaboration between CBO and the Department of Behavioral Health. Oh yeah, maybe we'll tap into SSG because they've done some of that. So we are open to tailor. So just like Erica and Jesse talk about, we don't just sort of give you a cookie cutter menu. We tell you, let us hear what your needs are. And then we are going to sit down and look at what are the resources and what are your specific questions. But some of the things that we hope to be able to do is to market to smaller counties, maybe smaller CBOs, who sort of look at us and go, you all got quite good at, you know, getting contracts and also collaborate. So talk to me about how to tap into the funding streams. So we want to support smaller CBOs in smaller areas to begin to look at the resources or the funding opportunities. So that's something that we can certainly help out with. We also want to help support the CCPs for the counties. And again, all the three different stakeholders. Maybe, and I hear this from the listening session, right? That we have data, but we're really having a hard time reaching out to some of these communities. So maybe we could help thinking about outreach and engagement and ways to enhance collaboration. So we can help the the ESM and the DBH to outreach to communities, just like we help the communities come into the county. So we want to support all of these processes. And one of the things that came up, again, that was a very powerful concept that I keep thinking about for the last week now is, and when we look at CCP, we hear people talk about building relationship, like Jesse was talking about, right? And there's a need for engagement and collaboration. Then somebody in the ESM said, let's talk about power sharing and define what that means. And that's a concept that's been sitting with me. And I think it really is, when we talk about equity, it is about how do we ensure that partners can really share power, and what does that look like? Is it sharing data? Is it sharing outcome? Is it transparency about funding, the funding hierarchy and the funding requirements? So these are the kind of areas that we're pretty good at, we think, because we've been doing these funding from different sources, from government, federal to county to state level. So we hope to be able to help CBOs and some of the groups maneuver, navigate, and look at some of these nuances so that we can ensure that there is more equal power sharing. And so for us, sort of the type of technical requests that really enhance the collaboration and empowerment would be really what we like, if you ask for us, our wish list. But again, we also can be available for just general, and sometimes it may be just a general query and not so much a request per se. And then maybe between the dialogue, we can come up with a pretty nice plan in terms of an actual TA. But we want to encourage folks to just have maybe open dialogue and say, I've been thinking about that concept. Jesse, what do you think from an evaluation perspective? Does that make sense? Would that be possible? And it end up may not be about evaluation. It may be about development of workforce, something like that. So I'm sorry to be so verbose. I hope I'm addressing all these, my little bullet points. Okay, so unless Jesse or Lindsay or Erica have anything to add, we're going to turn it back to Eliana.
This is why I really enjoy being in community with you all. And I can't wait to meet more additional SSG staff. As you were saying, really looking forward to future cafecitos with your staff. I think the way you talk about relationships, trust, and making it very concrete with power sharing. What does it actually look like between organizations, across cultural groups, and across specific dynamics like language and how data is shared? I mean, this is just brilliant. I feel like also having been in so many of those listening sessions that you were mentioning, Trang, that I can only imagine our audience is just smiling and thinking, that's exactly what I've been trying to get at. And I love the way that you really demystified, right, the TA process and saying, you may not have a specific question, you might just have an inkling to start off with. And through conversation, we can determine together what the question might be. And I loved, Erica, how you were talking about the partnership side. And Jesse also mentioned this, that the idea of doing with rather than for or to. For so long, our communities have that experience where somebody from outside in any number of ways will come in and say, this is what really needs to happen here. And I'm hearing your approach be very different, which is, let me listen to what is of concern and value to you. Then how do I join with you? It's such a refreshing idea to think about the expertise that is in community and that you're acknowledging that from the get-go. And I always tell people the secret, I think, to technical assistance is that in the best case scenario, I'm oftentimes as a TA specialist getting more than I could ever give from that relationship, because the people who are local have that local expertise that you really can't get unless you're local. And so it's this really beautiful ripple effect, right, that can happen where there's frankly a cross sharing. And it makes us all better in this work together. I'm just so excited for the community who haven't had an opportunity to meet you all to go ahead and submit that TA request at no cost on our website. And we would be delighted to partner them with you and your colleagues as well. As a final question here, I wonder if there's anything that you'd like to share about current projects at SSG, maybe their initiatives or other things that you'd like to highlight during this discussion. This is your opportunity to, speak on high about the great additional work that you're doing.
Whoops. Okay, I'm first on the list. I have to see my little bullet point. Okay, so I get to boast a little bit and tell you about our collaboration. So I think a few areas that Jesse mentioned is that we really truly believe in the partnership. So here, currently, we have a lot of different collaboration and partnership with community-based organizations. So we have 3 different FSP collaboration across agencies. The adult one started out both county and non-county agencies to provide FSP services for children, adults, and older adults, because we recognize that for AAPI and the diversity of their languages, there's no one agency that's going to be able to respond to all the threshold languages. So we found that for certain communities with such diversity, that interagency collaboration really works. So we want to highlight that. We want to share that with the folks for your county to think about. You don't have to be the one agency to provide 10 languages to, both folks from South Asian and also folks from Korea. So for diverse communities, we highlight interagency community collaboration, because it really builds on the strength and the resources of each agency and really a learning experience. And again, it's back to capacity building. We also are involved in different advocacy groups. So I'm with the AAPI Equity Alliance, formerly known as APCON. So we've done quite a bit of advocacy with the Board of Supervisors and also with the Department of Mental Health to ensure that there's equity in terms of outreach and engagement. And so one of the projects that we completed, which was very, very important for me, is the Prevention and Early Intervention Empowerment Project for a number of CBOs who don't have contracts with the county, but they have this opportunity to outreach and to identify very specific mental health needs for their communities. And we had about 14 different agencies, and these are non-contracted CBOs. So again, I think I want to highlight that, because I want the folks listening to this to, if they don't have a contract with their county. So for folks that remember to think about, well, you don't need an actual contract. Think about collaboration, think about ways that you can get connected and to do some of the really important work, because prevention and early intervention is key. Anybody in behavioral health will tell you the earlier you can do this, the more crisis you can avert. So we value that, and we really believe that it's an important piece. And we also have quite a bit of advocacy. Our APAIT has been doing a lot of advocacy to ensure that there's residence programs, housing programs for trans clients coming out from the street, unhoused folks, to find a ways to house them safely. So that's currently happening. And so these are some of the ways that we want to call attention to some of the collaboration and the current advocacy work that we do. And so we hope folks in other counties to think about your specific need and your specific population, and think about ways to collaborate, think about ways to expand, and think out of the box, and find ways to address and be responsive to the specific community needs. And I know my colleagues have other ones.
Thanks, Trang. Yeah, I want to zoom out a little bit too and talk about the various types of equity projects and systems change projects that we're working on. So we have and some of these are actually very small projects, which is exciting when there's a champion for some of this change with public agencies or foundations who's looking to partner to understand sort of impact and what data can tell you about their equity work. So we are working with the Los Angeles County Department of Arts and Culture on a demographic study of their public artists program. This is public art that is part of any county building. And this project is a direct result of the racial reckoning of 2021. And I believe, many counties, public agencies are thinking more critically about what equity means for them in 2022 and how their practices and systems perpetuate inequality and can be used to address inequality. So they're looking to understand what is the demographic profile of the folks that they have contracted with. So we're surveying those artists and we're working with them to understand where there are opportunities to make those systems more equitable. And similarly, we're working with the local foundation on an assessment of their grant making in Black and Brown communities in South LA. And the context for that is they are looking critically at the source of the foundation's wealth and the ways in which redlining, for example, contributed to these funds, and what is the role and obligation of the foundation in 2022, and acknowledging its history and using its resources to address that. I wanted to see if Lindsay wanted to add. She has a deep expertise on that project.
Yeah, it's been a really great project working with the foundation to kind of explore the ways that you can lift up communities through unrestricted funding, through repeated funding, and through trust-based philanthropy. And that's really just really eliminating a lot of the requirements that hoops that nonprofits generally have to jump through in order to get funded, as well as the restrictions for programming. So unrestricted funding allows them to keep their lights on, pay staff, hold in reserve for further future planning. So it's been really great partnership to learn about the ways that they are uplifting community, specifically funding power building communities, organizations that are working towards social change and social justice, and really trying to change the landscape of their neighborhood. And this is going to Erica.
I can maybe just add one more, which is I really love capacity building work just because it allows us the opportunity to be able to work with so many different types of organizations. And one project that we're working on is working with multiple organizations that serve justice-involved youth and being able to support them in their growth in understanding more about data and evaluation, and really understanding that it does always have to be what the funder tells them is data. They can really think about evaluation from multiple perspectives, and it is really thinking through it in a different way that might be more equity minded than what they've encountered before through the different systems that they've been in. And so it's been great to hear their perspective on different topics and being able to just connect them together, because I think one of the great things that we do in our work is just being able to listen to people's stories and therefore being able to connect them with other people who have similar stories or might have ways of contributing to each other's experiences. And so they are able to then share their experiences together and therefore be able to build resources or share resources.
You guys, I'm so excited about the work you're doing. I want to submit a TA request. I'm like, oh my gosh, there's so much to learn from you all. This idea, just that last point alone, Erica, what you were just sharing about, to really kind of question what is considered data, and to think outside of the box a little bit about how we are measuring impact and the really exciting opportunities to connect with others who are doing similar work and to share best practices and approaches. I love this back to also what Trang was talking about with connecting and resourcing relationships and leveraging those connections as being really critical. So many of us at any given moment could feel completely overwhelmed, right? With the significant disparities that are out there that have been only amplified, frankly, by the different disasters and emergencies that we've all been living through. But you all keep talking from a place that's clearly a place of hope. And it's from experiential hope that you're elevating. There are so many other organizations with whom people can share stories and best practices, and that we can think in creative ways and not be limited by kind of the historical boundaries that have been set. It's really exciting to hear you all kind of talk about that. And especially that your work is very intersectional, that you think about API communities and LGBTQ plus communities, that you're thinking about justice diversion and people who have experience with the justice system, and full service partnerships and across the lifespan. Every time I meet with you all, I learn something new. And so I'm really excited to work with you and genuinely looking forward to future Cafecitos as well. So without further ado, thank you so much to the four of you, Lindsay, Erica, Trang, and Jessie. It is just an honor to be with you all here today. Thank you to our audience, and please go to our website and submit a TA request, and you might luck out and be partnered with any number of these amazing colleagues of ours. Thank you so much. Have a great day, everyone. Take good care.
Thank you.
Thank you. Thanks,
Have a good
Eliana.
day.